Hi, my name is Tiffany Kendig. I'm a physical therapist and the director of the ReVital Cancer Rehabilitation Program at Kessler Rehabilitation Center. I'm excited to join you today to provide an introduction to cancer rehabilitation and metastatic breast cancer, specifically to discuss how therapists can help to optimize function and quality of life for individuals affected by metastatic breast cancer. So today, and over the course of the next 45 or so minutes, our goal is to recognize the potential impact of cancer and or treatment related effects on day-to-day activity performance in individuals with metastatic breast cancer, discuss some common issues with an emphasis on prominent issues like fatigue and cognitive decline that persons with metastatic breast cancer may face, and also to understand the role of cancer rehabilitation, including telerehab, in addressing these issues to optimize function and quality of life. So I'd like to start by just talking a little bit about trends in metastatic breast cancer that I'm sure you've heard quite a bit about today. As we know, it's estimated that as of this year, there are over 168,000 individuals living with metastatic breast cancer in the US. And we've also heard a lot about advances in treatment that are allowing individuals to live longer and contributing to the improved overall survival that we're seeing in the metastatic breast cancer population. And what we know about these advances in treatment is that it's really a balance. The goal is to manage the cancer effectively while maximizing quality of life. And a big component and a big factor in that balance is minimizing cancer treatment related side effects, because we know that the treatment options that we have do come with some side effects that can be anticipated. And we also know that these anticipated side effects can impact one's overall function and quality of life, as I'll be talking about later today. So what's the problem, and why is cancer rehab something that we should be thinking about and talking about? Well, as we just discussed, in the setting of metastatic breast cancer, we know that we're going to be on prolonged treatment, and that treatment looks different for different individuals depending on where they are. But we know that it's usually a combination of treatment, hormonal therapy being a mainstay, chemotherapy, other systemic therapies, potentially surgery and radiation. And these treatments come again with anticipated side effects, and that's what you see here. Some of the more common, definitely not all, but some of the more common side effects that individuals can experience. So for example, hormonal therapies. Very commonly we hear about pain, joint pain, or musculoskeletal pain. General physical changes, things like weight gain or concerns about body image. We hear about cognitive changes or difficulty with things like memory, concentration. Changes in sexual function, so perhaps painful sexual intercourse because of some of the effects that those treatments may have on the pelvic floor, as well as some genitourinary changes, perhaps incontinence due to weakening of the pelvic floor, and impaired overall bone health. That's under hormonal therapy, but what you can see here is some of the side effects that are often associated with different types of surgery. And again, not all individuals are on the same treatment regimens. Not all treatment regimens are associated with the same side effects, and not all side effects manifest the same way in different people. But it's really important that we are mindful of what these side effects are and that we're monitoring for them. Because these side effects, and especially in the setting of metastatic cancer, where it's likely that an individual will over time have multiple different treatment regimens, those side effects, again, are different by agent and modality, and they can accumulate over time. So if I have hormonal therapy, perhaps in the beginning of my treatment, and I also have chemotherapy, I may experience some pelvic floor issues or sexual dysfunction contributing from my hormonal therapy. But then perhaps if I have chemotherapy as well, I may also experience chemo-induced peripheral neuropathy or some nerve changes. If I then have surgery or have had surgery at some point in time, I may have pain at the surgical site. If that site is in the breast area or close to the arm, I may have limited shoulder range of motion, or perhaps late effects of radiation, such as fibrosis. And again, we need to look at and consider how these things interact together. in the research and what we know about individuals with metastatic cancer, metastatic breast cancer, is that there are some really commonly reported symptoms. These symptoms, some of the top 10 symptoms you see listed here, things like fatigue, thinking problems, sleep problems, pain, numbness or tingling, anxiety, sadness, hot flashes, nausea or swelling. Now, again, not all survivor or metastatic breast cancer survivors experience all of these side effects, but these are some of the more commonly reported side effects. I've highlighted here fatigue and thinking problems because these are some of the effects that as a physical therapist, I hear about quite commonly. And there are some areas where we can really help, and I'll get into a little bit more of that later. We can also help with things like sleep problem, pain, balance issues, or inability to kind of maneuver or coordinate the fingers in the setting of numbness. Or, of course, a lot of people are familiar with lymphedema or swelling. Those are all areas where rehab can help. And it's important that we recognize these symptoms. And the order of the symptoms you see here is how it was reported in a recent study where they asked individuals with metastatic breast cancer to rate some of the most common symptoms in terms of the severity that they experience them, but also in terms of the importance in getting help to address those symptoms. And fatigue and thinking problems, two areas where rehab can really help, as I'll show you today, were mentioned as two of the top 10 reasons, the top two reasons where patients are seeking help to manage these symptoms. So why is it important that we understand side effects? Side effects can contribute to what we in the rehab world can call impairments, things that limit our ability to perform our day-to-day routines. So if I, for example, have fatigue, I may not be as able to perform my job or keep up with my children as I used to before treatment. That's what we refer to as a functional limitation, because function refers to our ability to perform or engage in tasks or our everyday activities. So again, going back to the research and what has been shared by individuals with metastatic breast cancer in that research, there are several factors that individuals with metastatic breast cancer have identified as really driving how they're relating or how they're rating the importance of their symptoms and the desire to have those symptoms managed. And you see some of those reasons, some of those underlying themes here. Activity restriction. So what is the impact of those side effects on my day-to-day activities? Concentration difficulties. So what is the impact of these side effects on my ability to think or sustain attention? Are some of these side effects perhaps concerning because we perceive them to be worsening other physical symptoms? Are we perhaps concerned about the symptoms as they relate to long-term health concerns? Or perhaps how they impact relationships with others. So an example of impact on relationships with others, given in the literature, would be an individual who is experiencing a lot of pain or fatigue. And because of that, they're exhausted and perhaps less patient, feeling like they're less patient with their loved ones or family members, and feeling like that's really impacting the relationships in their lives. What's really interesting about some of this research is that the most common reason for symptom importance, as rated by individuals with metastatic breast cancer, is its detrimental potential impact on their activities of daily living. So here are some quotes from a recent publication by Mosher and colleagues that really drives this point home. They say the majority of patients that they interviewed with metastatic breast cancer rated symptoms as important because they restricted their social, recreational, or work-related activities. And more patients described physical symptoms, things like pain or fatigue, as restricting their activities more than psychological symptoms. So again, everybody is different, and how these side effects impact an individual is different. But an underlying theme is that what we believe is that these side effects impact our ability to function. And this is really important because if we think about function in the setting of cancer, our ability to perform our day-to-day lives and our ability to function as best as we can not only helps to put treatment options on the table and helps us to best tolerate treatments, but because so much of what we do and how we function defines who we are. And that is a huge component of quality of life. So we really need to consider, again, the impact of side effects or impairments on an individual's function because it has a clear relationship with quality of life as an individual progresses through cancer treatment. So in the cancer research in general, what we see is that individuals undergo treatment, at least a third, and this is not specific to metastatic breast cancer, this is a number of different types of cancers, but at least a third of individuals report that as they go through treatment, at some point they experience some type of difficulty with basic activities of daily living, things like dressing, bathing, grooming, things that walking, getting up and down from a chair, things that, we don't necessarily think about a whole lot in our day-to-day life until they may become a little bit challenged. At some point, about half of individuals reported needing assistance to perform instrumental activities of daily living, things like managing the house, grocery shopping, managing finances, and things like walking, getting up and down from chairs, doing housework, shopping, and transportation are some of the activities that are most commonly referred to when individuals are asked what types of activities they experience difficulty with. In the setting of metastatic breast cancer, research shows that when asked, about 92% of individuals report at least having at least one impairment, so one of those side effects that can contribute to potentially difficulty with function or day-to-day activities as they go through their cancer experience. And as we talked about before, because there are often multiple treatment regimens, usually these symptoms can kind of accumulate over time. And the number of side effects or troublesome impairments that an individual may experience is highly variable and depends on a number of factors. But what we do know is that individuals who tend to be more independent in terms of their functional performance, their ability to perform their day-to-day, if that is lower, then those individuals tend to have more impairments. And of course, as disease burden increases, so does the number of functional impairments based on the literature. So all this to say, there is a role for cancer rehab services for individuals affected by metastatic breast cancer. And here's why. Because rehabilitation specialists, doctors of physiatry or physical medicine and rehabilitation, physical therapists, occupational therapists, speech therapists, cognitive therapists, lymphedema therapists, play an important role in the overall cancer care team. And our role is different and it's unique because it's really centered around four main goals: improving function, improving participation, meaning the ability to participate in life roles that are meaningful to the individual. For me, it would be completing my work as a physical therapist or being a mother to my 3 children, for example. Reducing the risk of late effects of treatment, so reducing the risk of fatigue or weakness as an individual goes through treatment, and improving overall quality of life. This is the goal and the role of cancer rehabilitation in metastatic breast cancer. So to put it in perspective and just to summarize, we know that cancer and its treatments have anticipated side effects. And we know that while we work to minimize those side effects, they do occur and they have the ability to impact our ability to function and perform and engage in our meaningful life roles. That's where cancer rehab comes in because our focus is function and improving overall quality of life. So I just want to take a minute and reflect back to the study that we talked about earlier, looking at some of the most severely rated and important symptoms to individuals with metastatic breast cancer as reported in the literature. And again, the top 2 were fatigue and thinking difficulties. So often we hear individuals who come to therapy and say, gosh, I wish I would have known about this. I wish I would have known there were some other things out there that could have helped me, sooner. And so my goal today is to really talk about those two symptoms. And then I'll spend a little bit of time talking about some other symptoms. It's beyond the scope of this talk to talk about all of them, but to talk about some of them and how cancer rehab services can help so that you can determine if talking to your doctor about whether or not cancer rehab is right for you is something that you should do. So first, I want to spend a little bit of time talking about cancer-related fatigue. And it's something that I think people talk about quite a bit, but something that we can also do more about to help individuals with metastatic breast cancer. So what is cancer-related fatigue? You see the definition here. It's a distressing, persistent, subjective sense of physical, emotional, and/or cognitive tiredness or exhaustion related to cancer or its treatment that is not proportional to recent activity and interferes with usual functioning. So there are a couple important points here that I'd like to make very clear. Cancer-related fatigue is extremely common. It is nearly universally reported for individuals who undergo chemo, radiation, or biologic agents. About 80% of patients who receive chemo and or radiation report cancer-related fatigue. And it's also very common in individuals with metastatic disease, occurring in about 75% or more of these individuals. What we very often hear is that it's persistent and disruptive. And many rate cancer-related fatigue as moderate to severe as they progress through treatment. What we also know is that it's often reported as one of the most distressing cancer and treatment-related symptoms. And what we also know is that unfortunately, it's also one of the most underreported, underdiagnosed, and undertreated treatment-related effects. So what are the symptoms of cancer-related fatigue? What are we really talking about here? Very often, we're talking about feelings of being extremely tired or exhausted, even after a good night's sleep, restful sleep, a lack of energy or prolonged tiredness after activity, weakness or heaviness, feeling that it's very difficult to continue to move on, feeling listless or irritable, trouble starting or finishing tasks due to tiredness, and difficulty with concentration or memory. And we'll talk about that a little bit when we talk about cognition. Feeling like you need to sleep during the day, and inability to do usual or desired activities because of this disproportionate fatigue. Generally speaking, criteria are that this fatigue lasts for a period of more than 2 weeks, and again, is not relieved with rest. Cancer-related fatigue is interesting because it most commonly occurs with some other symptoms and is very commonly associated with things like pain, emotional distress, anemia or low red blood cell counts, sleep disturbances. So these symptoms tend to occur in clusters. And it has a strong impact. So going back to some of those studies that I mentioned before that kind of amplify the voices of individuals affected by metastatic breast cancer, what's the impact? Well, there can be a profound impact on day-to-day life. Here you see a quote from an individual that says, "I can't do all the things that I'd like to do normally. Doing things for the kids or even just going to a concert's a big ordeal. Going to eat in a restaurant, I don't even like doing that anymore because I get too tired waiting. So being tired doesn't allow me to do any of the things I normally do." And this can be very problematic because it can turn into a little bit of a cycle. If we're so fatigued that we're now pulling back from the activities that we enjoy, that the roles that give us purpose and fulfill us, that activity avoidance can lead to further functional decline. So it's really important that we understand and work with the cancer care team to appreciate the causes of cancer-related fatigue and to address it. So here, what you see is cancer-related fatigue is really multifactorial. There are a number of factors that can influence it or cause it. Many include cancer or cancer treatments such as chemotherapy, radiation, hormonal therapies. In some cases, it can also be due to the cancer itself. Other examples that can be contributors to cancer-related fatigue would be pain, decreased red blood cell counts, poor nutrition, so inadequate food intake or hydration, other medical issues, lack of physical activity, medications, emotional distress, and sleep problems. What's really important and what best practices and clinical practice guidelines recommend is that all professionals in the cancer care team and the patients themselves are screening or monitoring for cancer-related fatigue, so that if it becomes problematic, we can help to address, work up some of those contributing factors with the help of the medical team, and then help to intervene early to hopefully minimize impact and optimize function and quality of life. So the recommendations in place for screening for cancer-related fatigue are really to ask yourself, or to have someone ask you, to rate your fatigue over the past 7 days on a scale from 0 to 10, with 0 being no fatigue and 10 being the worst fatigue imaginable. And also asking yourself, has it caused a change in your ability to perform daily activities such as walking, working around your house, or performing other duties that are important to you? Generally speaking, if an individual rates cancer-related fatigue as between a 0 and a 3, there are some general strategies: education, monitoring fatigue over time, and encouraging of safe exercise and physical activity to help manage fatigue. If fatigue is rated a 4 to 10, then what's generally recommended is more of a structured workup to identify factors that are contributing to the fatigue, to address any of those components that may be modifiable or medical in nature. And as I'll talk about in a moment here, therapy, and specifically how therapy can help with exercise, could be a very important component to management. What we also know is that fatigue can fluctuate over time. So it's important that all individuals are kind of monitoring. If you have an onset of cancer-related fatigue, is there a pattern, certain times of day or after certain types of treatment, where you're feeling more fatigued? And how long is it lasting? Is the level of fatigue changing over time? Does it seem like there are any factors that are contributing to alleviating the fatigue, making it better, or perhaps not making it better and not changing it? And again, as we talked about before, the impact on overall function. So it's important that our healthcare providers are asking about cancer-related fatigue, but it's also important that individuals with metastatic breast cancer are mindful of fatigue and reporting it, or initiating discussion with a healthcare provider should they experience fatigue, so that we can best intervene to help manage it. So management of cancer-related fatigue is really a team effort and involves multiple components. First and foremost, especially if that fatigue is a 4 out of 10 or greater, identification and treatment of any medical conditions like pain, anemia, depression, or endocrine abnormalities, for example, is really important. Once we kind of know what some of the factors contributing to fatigue are, there are other general practices that are really good to help combat it. Sleeping well and resting, but not resting too much. Energy conservation strategies, so perhaps pacing activities throughout the day, or considering building in rests would be examples of energy conservation. Having others help out, so not pushing through, because as we know, if fatigue, like pain, can be cumulative. If we continue to push through, it can get worse. But if we pace, ask for help, and really take care of ourselves, we can get a better hold of fatigue. Good nutrition and hydration are extremely important. Minimizing stress as much as possible. Distractions, things like reading a book or mindfulness, are good and definitely recommended strategies for managing cancer-related fatigue. Medications, if indicated and prescribed by the medical team. And staying active. And you'll see here, I have this highlighted because aerobic exercise in the research has found to be the best treatment for cancer-related fatigue. And this is a role in an area where rehab can really help, because very often we'll be working with an individual and they'll say, I'm so exhausted. I have, and cancer fatigue is a real phenomenon and it needs to be addressed as such. And so then when we say, okay, I'm going to help you get on an exercise program to help with it, we often get, are you kidding me? I'm exhausted. I just told you I was exhausted. But as you see here, evidence overwhelmingly supports a significant benefit from exercise in reducing cancer-related fatigue. So there's a big role for therapy, physical therapy, occupational therapy, in helping an individual to engage in a tailored, safe exercise program or way of increasing physical activity to help manage fatigue. But that's not all in terms of what therapy can do to help manage cancer-related fatigue. So physical therapy isn't only about exercise. It's a more holistic approach than that. We do a lot of aerobic and strengthening activities, yes, for sure, but we also focus on things like posture and body mechanics, how we move our body, because moving efficiently and using our muscles appropriately will contribute to decreased levels of fatigue, overall efficiency. We also teach techniques for relaxation and mindfulness. We know that cancer-related fatigue is very multifactorial and can affect different parts of our body and our structures. There's also a mental fatigue component that goes along with it as well. And if we can help with some of these relaxation and mindfulness activities, it can help with mental fatigue and any underlying anxiety that can possibly come along with it. Finally, we can help to educate on good sleep hygiene. For example, tips on how to get a good night's sleep or positioning, and on energy conservation strategies and activities. We also do a lot of journaling, which can be very eye-opening and insightful when learning how to adapt your energy levels while going through treatment so you don't overdo it one day just to be completely wiped out, perhaps the next day. Occupational therapists are also rehab professionals that can help with cancer-related fatigue. It's a different discipline than physical therapy, but often what we do crosses over. There are some important distinctions when it comes to evaluation and treatment. The occupational therapists are very well versed in looking at occupation, not only as related to employment or what one is required to do for their job, but overall important day-to-day and meaningful activities for an individual. They too can educate on energy conservation, improve functional mobility. They also have added skill sets to help with home management skills, self-care activities, and can help with assistive devices as needed. We're going to talk about cognitive or thinking issues in a moment here, but cognitive rehabilitation is also under the scope of practice of occupational therapy. And so if mental fatigue or cognitive fatigue is something that's really impacting an individual, occupational therapy can really be helpful there as well. So just to summarize how a rehab professional may help to manage cancer-related fatigue, graded progressive exercise, which we know from the evidence is one of the most effective ways to address cancer-related fatigue, energy conservation, specialized training for the functional tasks that are important to you, and also enhancing performance status. So our independence with our activities of daily living. Again, that's really important because it also influences how an individual tolerates treatment. And then tips for overall wellness. So helping individuals to meet recommended guidelines for activity and wellness that will be helpful for overall function and well-being. So we've talked quite a bit about cancer-related fatigue, what it is, and how cancer rehab can help. And I want to shift gears and focus a little bit more on cancer-related cognitive decline. And part of the reason I wanted to talk about this is because, again, we often hear from individuals with metastatic breast cancer that thinking problems or feeling foggy or not being as quick as they used to feel is something that is quite bothersome. And that's what we also see in the literature. And unfortunately, we also hear people kind of refer to some of these things as the new normal, thinking that perhaps there's nothing that can be done about it, that it's a necessary side effect of treatment. But the reality is that this is an area that cognitive rehab can help. So I just want to go through a little bit about what cancer-related cognitive decline looks like. But before I start talking about it, I want to start with a little activity to test your cognitive skills and to prime your brain for the information that I'm about to share with you on cognition. So I have on this slide a list of 10 words. I'm going to give you about 30 seconds to do your best and just try and remember these words, which I'll then place back up at the end of the presentation. So just take a few minutes to look at the words on the screen in front of you. Okay, so we'll come back to that. Remember those words. Let me start by defining what we mean when we're talking about cancer-related cognitive decline. So cancer-related cognitive decline is cognitive changes and impairment observed in patients with cancer that can be related to the direct effects of cancer itself, non-specific factors, or other conditions, other health conditions that are independent of the actual cancer and or the treatment or combination of the treatment administered. Cancer-related cognitive decline is the term that's now being utilized for patients with cognitive decline related to cancer. In the past, or in other places, you may hear about this as chemo fog or chemo brain. But the term cancer-related cognitive decline is really more appropriate and comprehensive. Number one, because these difficulties or experiences aren't necessarily always the result of treatment. We see them occur from diagnosis even before treatment. And it's also important to recognize that some of these changes can be very mild. So they're not necessarily considered an impairment in the objective sense. However, mild changes can really impact how an individual perceives their ability to function in their day-to-day life. So here are some potential causes for cognitive decline. And I say potential because, as we talked about before, the way cancer and its treatment impacts an individual looks different for everyone. So cancer causes the body to initiate an immune response, and this is started by cytokine cells. What's being found in recent research is that an increase in these cytokine levels can increase risk for cognitive decline or those feelings of fogginess or cognitive impairment. And not only does cancer cause an increase in cytokine levels, but also chemotherapy can as well. Chemotherapy can have a neurotoxic effect that can contribute to cognitive changes. Immunotherapy. It's a relatively newly developed treatment approach that we know, but research in this area is emerging, and there does appear to be some correlation between immunotherapy and potential cognitive decline. Radiation, especially radiation to any part of the central nervous system, especially the brain. Also, hormonal medications, including things like aromatase inhibitors, as well as drugs such as tamoxifen that work to reduce the body's production of estrogen. These can also contribute to cognitive impairments, as estrogen plays a really important role in brain function, specifically in the communication of neurotransmitters. Cancer-related fatigue, which we just talked a lot about, is one of the most commonly reported symptoms. And we know, as we all know, that when we're tired, it makes it more difficult for us to focus our attention and for our brains to function. And lastly, stress and other psychological factors, such as anxiety or depression, especially during the treatment process, is really common. And these things can really have a direct impact on cognitive function. So here are some numbers related to the prevalence of cancer-related cognitive decline in individuals, in adults with cancer. So up to 30% of adults with cancer report experiencing some sort of cognitive decline or changes at the time of diagnosis prior to treatment. So we talked in the previous slide that prior to treatment, cognitive impact may be related to increased cytokine levels. It can be related if there is tumor in the brain, but also the fatigue and stress often accompany a cancer diagnosis can contribute. And about 75% of individuals with cancer report cognitive changes during treatment, which the highest likelihood of this is due to the effects of treatment, especially cancer-related fatigue, stress, illness, and nausea, things of that nature. So here are some potential causations for cognitive decline that you see here. And what this diagram shows, Dr. Ailes, who wrote this article, what it shows is that there are many factors that can influence cognitive function, our ability to kind of, for all of our cognitive functions to work together in symphony successfully. And as you can see here, things like the tumor themselves, tumor type, tumor stage, tumor location, socio-demographic factors, older age could be associated with decreased cognitive function or greater risk for cognitive decline, for example. Socioeconomic status or education, different types of treatment, whether or not potential cognitive impairment was present before the time of diagnosis, psychological stress, anxiety, and depression, different lifestyle factors such as smoking, exercise, diet, and sleep quality, and different loads on the system can all influence how cognitive changes how or if they may occur for an individual with cancer. So what you see here are some of the typical cognitive complaints heard from patients reporting cognitive decline, as reported by the American Cancer Society. So when we think of cognition, it's important to understand that there are several domains or functions that kind of work together in concert to allow us to successfully function. Some of these domains include things like attention, speed of processing information, memory, so our ability to remember, encode and remember information, executive function, how we think through problems or make judgments, and then word finding and verbal fluency. In the next few slides, we'll do a brief review of some of these definitions and the functional impacts that decline in some of these areas may have or how they may manifest. So, attention. This is really referring to our ability to focus our awareness on a given task or to concentrate on a task long enough to accomplish a goal and to shift awareness between tasks as appropriate. So some examples, if we perhaps are experiencing decreased attention, difficulty sitting through an entire movie, or following a conversation in a really complex environment like a grocery store or a busy restaurant. Shifting back and forth between making a recipe, reading the recipe, and preparing the meal, or perhaps misplacing things. And this is something that we hear about a lot. I'm always misplacing things. I can never remember where my keys are. And most people often think that this is due to a decline in memory. But usually what we see is it's actually due to our attention. So things that we do more automatically or more rote for us. I walk into my house and I put my keys down. I'm not usually paying attention to where I'm putting my keys down. And so it's not necessarily that I have forgotten where I put them down. I wasn't attending to what I was doing in that moment to begin with. So when we start to appreciate these nuances, it starts to become very clear where strategies or different or ways that cognitive rehab can be especially helpful. Things like taking a moment to attend to what you're doing, perhaps even saying out loud, I put my keys on the kitchen counter, may be a good example. So speed of processing refers to the pace at which you take in information, make sense of it, and then begin to respond or react to it. So difficulties or changes in the area of speed of processing may look like having difficulty and challenges in conversation, responding appropriately, or being able to maintain the train of thought or the flow of the conversation. Some individuals may experiencing this as their ability to be listening in at a doctor's appointment and take in that information and respond appropriately to it. Learning new information or perhaps starting a new task at work may seem more difficult or just like it's longer to get things done. And this is an area where, again, strategies can be extremely helpful. Memory is not only remembering things, but it's the process of learning, encoding, and that encoding means assigning meaningfulness, storing and retaining, and then retrieving information. So our ability to search and locate that information. Learning and encoding is really the job of our working memory. This is sort of like our brain's mental blackboard, which has a certain capacity. And you can think about this kind of like a large desk in a conference room. And perhaps, at work we have a number of files and they're arranged on the desk and very well organized, and it's easy for us to locate that information, retrieve it, and put it to use when we need to. But if there's a change in the system, perhaps because of cancer or its treatment, then that mental blackboard or that mental conference table may feel smaller. Our capacity to kind of store that information so we can easily retrieve it may become more difficult. You can imagine, an analogy of if my desk got much smaller and now I still have all those files, but they're less organized, it's going to take me more time and cause me more difficulty to try and retrieve and use that information. So some functional examples of how this may look or feel is forgetting details during a conversation, or difficulty recalling to make a stop on the way to work. We've worked with some individuals who say, gosh, I was going somewhere, I was going to do something, and I truly just can't remember where it was, where I was going. So this is an area where, again, cancer rehab and specifically cognitive rehab can help with strategies to enhance working memory or to organize that mental blackboard. So that individuals can perhaps feel stronger about their functional performance and, again, engage in those roles that are meaningful to them. Executive function refers to the higher order cognitive functions needed for the purposes of goal-directed behavior, including planning, conceptualizing, organizing, reasoning, insight, problem solving, evaluation, judgment, and effective execution of an action, especially in novel, new, or unique situations. So this is really a complex cognitive function, and it's really one of the most commonly seen challenges in individuals who experience cancer-related cognitive decline. It's basically the brains or the CEO. So you can think about what a CEO does for a company. They help to organize, manage, monitor, plan, and anticipate potential challenges. That's what the function of our executive functions, our brain, are doing. But if we're experiencing cognitive decline, that may look like difficulty tracking or estimating time, challenges with initiation or setting realistic goals, difficulty managing a schedule, whereas perhaps before it was a lot easier, increased difficulty with organization, trouble with problem solving, or trouble with mental flexibility. So again, solving problems, especially for a newer situation. And And last but certainly not least, word finding. So word finding is another commonly reported challenge in individuals with cancer-related cognitive decline. Often we'll hear someone say, I'm thinking of a word. I know what the word is. It's on the tip of my tongue, but it just doesn't come as easily, or perhaps it takes longer. This may look like word finding difficulties in conversation and may cause some individuals to kind of pull back or withdraw from social situations. So this is something that we see and hear about very often. Perhaps if someone's used to being at work and giving presentations and talking off the cuff, perhaps others may not perceive if that individual has that tip of the tongue feeling. But for the person in that situation, that can be extremely frustrating and can definitely impact their perception of their cognitive function and how they're able to carry out that role, in this example, one's job. So this is an area where really understanding and appreciating the complexity of the tasks and the requirements for our day-to-day life are, and using rehab strategies and different strategies so that we can effectively carry out those day-to-day responsibilities with less frustration should we experience a problem in this area. And last but certainly not least, I do want to touch a little bit on cognitive reserve, because this is a really important concept. It's not necessarily one of the cognitive domains that I talked about, but this is a person's capacity to maintain normal cognitive function in the presence of brain pathology, or really in the setting of changes, perhaps because of cancer or its treatment affecting the brain. This concept came about when researchers were trying to determine how some individuals, whether it be Alzheimer's or brain injury or stroke, may not be as impacted as others. So if they had something that happened, why for some individuals did this cause big problems with cognitive function overall, and for others, the impact wasn't quite so great? And what they're finding is that patients who have higher cognitive reserve or are functioning at a higher level or have higher cognitive capacity prior to initiation of perhaps a treatment or a cancer diagnosis don't have aren't as impacted as those who have a reduced cognitive reserve prior to this. So our cognitive reserve is really kind of, you can think about it about the gas in your tank. The more gas you have, the further you're going to be able to go. And this is things that impact cognitive reserve are things like age, one's occupation, schooling, new learning, and exercise. So some of this may resonate with some of you here today, but we're often asked, how can I tell if this is something that may be affecting me? And the important thing is you're the expert on you. But there are a couple of easy questions that you can kind of ask yourself to start thinking about these things. You can possibly ask, in the past 7 days, has my thinking been slower? Has it felt slower to me? Has it seemed like my brain's not working as well as usual? Has it felt like I've had to work harder than usual to keep track of what I'm doing? And have I perhaps had some trouble or changes when shifting back and forth between different activities that require thinking? Thinking about these questions can help provide insight. And if you are having some changes or experiencing some potential signs of cognitive decline, it's important to talk with your cancer care team so that they can help to address it and perhaps refer for cancer rehab, specifically cognitive rehab, to help address. Because there are a number of ways that we can improve cognitive reserve and overall cognitive function. There's good evidence for this. Some of the ways that we can improve cognitive reserve specifically are exercise, opportunities for new learning, things that could be kind of cool and new, like learning a new language or trying a new recipe, taking a new class or learning an instrument, even listening to this presentation are opportunities for new learning. Improving nutrition, reducing stress, and continued socialization and engagement are all important ways that we can help to improve cognitive reserve. And what can we do to improve cognitive reserve and improve cognitive functioning overall? Individualized cognitive therapy to help understand and appreciate how different treatments may be impacting you is a really good place to start. And then use of appropriate compensation strategies, if and when appropriate, like external memory aids or information management systems, things like journals or listing. Reducing distractions while working or completing tasks, so perhaps a quieter environment. Planning ahead, knowing what we're going to do and pacing our activities throughout the day is extremely important. So if perhaps I have a big presentation or a large work task that I know I need to do, I might plan to do that in the morning, and I might not plan to do that after I get up, take care of the kids, go for a walk with the dog, and then do that because I may have more fatigue and more cognitive fatigue at that time. Breaking down tasks into manageable steps to help focus on those steps, and then allowing time for breaks so that we can enhance our cognitive reserve, optimize our energy, and really enhance cognitive function. And then participation in cognitively stimulating activities. So these can be anything from table games to things like solitaire, chess, Connect Four, things that require strategy or thinking, tablet games. Here you see a couple of examples there, and then websites, Brain HQ, Luminosity, Fit Brains, for example. These are all places where one can find cognitively stimulating activities. And your cognitive rehab therapist is going to be able to really help hone in on where that difficulty may be arising from and some strategies to help remediate or compensate to optimize function and overall quality of life. So to wrap up on that section of cognition, what words do you remember? I'll show you the list again. How did you do? So although it seemed like this was just a memory task, I want to highlight that in order to remember these words that you needed to use your attention. You needed to be able to focus on the word list. You needed to use your working memory to hold on to the list, to put it onto that mental blackboard. You needed executive functioning working here to identify the strategies you could use to remember these words. Maybe it was relating them to things that are important to you, or using associations or chunking words together, repeating them, or even coming up with a story to help you remember. I hope, though, that what this portion of the talk helped to do is shed some light on the problem of cancer-related cognitive decline and highlight the role for cancer rehab in perhaps helping to address some of those problems. And I just wanted to give a few more examples, because if you'll recall from the beginning of the talk, we mentioned that, again, there are numerous types of treatment for metastatic breast cancer, and there are potential, different combinations and manifestations of side effects and how they impact function. Some of the more common things that we hear about or that cancer rehab can help with would be shoulder problems or tightness or pain. This can limit things like reaching in cabinets, lifting grandchildren, fastening a bra while dressing, or even wiping when performing hygiene. Cancer rehab can help with a number of these activities because we're the specialists in things like helping with range of motion exercises, providing hands-on stretches, massage, or joint mobilization, exercises to help stabilize around a joint to help you move your arm better, and different modalities, things like cupping or taping that can really help to decrease tightness or pain if that's something that's perhaps problematic for you. Other areas where cancer rehab can help. We talked about hormonal therapies, and the problem of muscle or joint pain is very real and very common for individuals who may be taking some of these medications. But the good news is that there are things that can help to manage it. This may manifest as some difficulty with daily tasks, difficulty with cooking, manipulating utensils, or opening jars, for example, or kind of stiffness or difficulty with writing or typing. They can ultimately make things like work-related tasks or kitchen tasks, as we described, a little more difficult. Therapists who specialize in cancer rehab have strategies including exercise, positional modifications, joint protection strategies, perhaps like splinting or working on how we're moving, and strengthening exercises to help manage that discomfort, which can be extremely important for individuals who are on this type of therapy. Another example may be sexual dysfunction. Again, hormonal therapies or certain types of chemotherapies can cause weakening of the pelvic floor, which can contribute to incontinence, or changes in muscle spasms and tone in the pelvic floor, or perhaps dryness that can lead to pain with medical exams or intercourse. And this can have big implications on relationships and one's desire to perhaps go out if you're experiencing incontinence. Individuals who specialize in pelvic floor rehab can work on these types of issues to help improve them and optimize overall function by discussing vulvar health and lubrication or moisturization, talking about sexual positions or recommendations that may be more comfortable, pelvic floor exercises that may help with things like incontinence, and referral to other specialists that can help on the team to optimize function in this area if it's something that is troublesome for you. And last but not least, when we talk about cancer rehab, perhaps what individuals are most familiar with is lymphedema, which is, a feeling of heaviness or fullness in an extremity that may have been affected by surgery, or this can happen in the trunk as well. But after surgery or in the setting of radiation or anything that causes our lymphatic system to perhaps become backed up, cancer rehab can be extremely effective in helping to manage lymphedema through complete decongestive therapy, which entails things like specific types of muscle pumping exercise, a specific type of massage called manual lymphatic drainage, compression bandaging, skin care, or even positioning of the extremity to help manage edema. So I've talked about quite a bit today with a large focus on fatigue and cognition, but I hope what I've helped to highlight is that cancer rehab specialists are part of the cancer care team, and they're here to help with important components that relate to function and quality of life that are personally meaningful. So, putting this all together, if you're experiencing cancer or treatment related effects that are perhaps causing you to change or slow down the way that you're participating in your day to day activities, talk with your doctor to see if cancer rehab might be something that could help you to optimize overall function and quality of life. And just in closing, I wanted to quickly talk about, I'd be remiss as we have this conversation, not to acknowledge the current situation with the pandemic. And a big question that we're getting now is, how can I access cancer rehab services? So I would seek out a specialized cancer rehab therapist to help with some of these issues. And if perhaps because of the current situation with COVID, going to a cancer rehab specialist is perhaps not an option, or perhaps they're not in your area. There are tele-rehab services, and tele-rehab services have been shown to provide access to specialty care that saves time and perhaps cost through transportation and things of that nature, by kind of bringing therapy, if and when appropriate, to you in your home via tele-rehab. There have been a number of studies out there that have looked at the benefits of cancer tele-rehab, many of which have been done in the breast cancer population, and have demonstrated that tele-rehab can have a really significant and positive impact on overall function, coping and problem-solving skills, quality of life, cognition, cancer-related pain, fatigue, anxiety, and depression. And they've also shown through these studies that through tele-rehab, therapists and patients are really able to build a solid foundation and a strong relationship. For individuals with advanced cancers who perhaps experience a hospitalization, they've also shown that those who participate in tele-rehab were more likely to be discharged to home and spend fewer days in the hospital. If that were the case, there's also been evidence to show that patients are satisfied with tele-rehab services, which is fantastic. And that when appropriate, there are times that we do need individuals to come in, but when appropriate, similar improvements to in-clinic care have been shown, which is fantastic. And these have also been shown to be highly cost-effective interventions. So if you think cancer rehab might be the right thing for you, I did want to just briefly mention that tele-rehab may be something to consider, especially in the time of the pandemic, or in the event that you don't have a cancer rehab specialist near you. So with that, I will close, and I'm happy to take any questions that you may have. I'm also happy to connect at any point, so please don't hesitate to email me or reach out if I can be of help in any way. Thank you.